Experimental and very promising. A high-tech device is now changing life for this young boy from Tampa. And tonight we're learning doctors will use something like it to help soldiers who are coming back from war. Dr. Joe, sounds cool. Talking about brain science here, what's in the works?
Oh my goodness, it is so exciting. I just spoke with a neurosurgeon from Boston, Massachusetts, and he was telling me about what is in the works. And basically what they're going to try to do is they're going to try to attack this little area in the brain. It's called the amygdala. That's involved in post-traumatic stress disorder. So it's that emotional center where these soldiers coming back can be severely affected. But what they're doing is they're combining their efforts with UC San Francisco. That's the video you're seeing right here. And we have something called neural engineering, believe it or not. And they're creating these things, they're called they're brain-machine interfaces. There'll be sensors that will be placed somewhere on the head, maybe under the scalp, perhaps on the skull, and that will pick up signals within the brain where there are abnormal maybe discharges, and at that point something will be implanted on the brain to then give them little tiny impulses to try to counterbalance it or to correct it. And when you think about Austin Street Matter, that's the young man that we had profiled previously. He has something called dystonia, so that's a movement disorder. So when they implant these particular things, it's really kind of an open loop. So it's constantly discharging these impulses to that area to make him be able to stand straight and to play football. In this particular case, it's going to be triggered by an abnormal response. So very, very complex situation. But if you hear what Austin had to say, I mean, he says that his life is totally changed by the stimulator.
That was when I knew it worked, when I made the basket and I came back and I could backpedal. When I could first backpedal back, that was when I knew something just changed and my life is totally different now.
How did that make you feel?
Yeah, it would have been weird for me to do a cartwheel in the office, but I was on the brink. I was on the brink. It was very exciting, very, very exciting.
Now, you know, Austin is doing so well. You can see he's doing zip lining here. And so they're hoping to do something similar, but again, it's going to be a lot more complex.
Yeah, so what do you think here is next, Joe?
You know, it's going to take about 5 years to get this in motion. They're creating these tiny little flexible implants, and then they're going to have to test them on animals first. So they're saying it's going to take a bit of time. But again, because a movement disorder is a little simpler, because they're just going for something that's going to change the way the person, you know, operates, it's more complex when we talk about depression and post-traumatic stress disorder. But exciting, exciting information and news out there.
Yeah, great to see Austin smiling like that and doing so well. Very inspiring.
Great
All right,
kid.
Joe, thanks very much.